Everybody, Dr. Demito here, and we're going to take a look at this article, The Three Buckets of Prevention, as opposed to you reading it out of the Journal of Public Health Management. Let's just have a quick discussion about it. I think that you'll get a little bit more out of it if we just discuss it like this. And if you have any questions, you can refer those back to me. So the U.S. healthcare system, it's in a time of change right now. And we don't quite sure which direction we're going to be headed in. So we're hoping that there's going to be an expansion, the ability for people to have insurance coverage, redesign the reimbursement systems, and we know that there's a growing influence of patient-centered medical homes and accountable care organizations, and it brings a lot of opportunities forward. One of the things that comes forward to me when I think of this is Oak Street Health. So Oak Street Health used to be, gosh, what was it? Was it Oak Park Hospital? I can't remember. You guys out there might know it more than me, but back in the day, I used to go see students who were doing clinicals, and they would do clinicals sometimes for their nurse practitioner in that facility, working with physicians. And now it's Oak Street Health, and it is like a all-in-one center for people to get their health care, and its primary focus is on the older adult. And I'm very interested as to how that health system works, because it's all inclusive. You can go there to get everything done. They have all of the specialists there. They all focus on the older adult, and it sounds glorious, right? I don't know how it is in real life. It may not be so wonderful, but the concept sounds really good. And you'll see that a lot of medical centers are changing abruptly. For anybody who lives out in the northwest suburbs like I do, you'll note that Alexian Brothers Medical Center in Elk Grove Village, a hospital that I worked at for 18 years, they're closing their maternity unit. Alexian Brothers Medical Center is part of Ascension now, I believe. They've switched leadership at least 4 times in the last 4 years. But they have a large hospital in Hoffman Estates, St. Alexis, that has a level 3 nursery, which is the highest level that you can get. And so they are farming all of their deliveries over to St. Alexis. You're going to see this in other hospitals too, through the Endeavor system. Some hospitals, they're going to focus all their energy towards cardiac. Another hospital is going to focus all their energies on cancer. So you're seeing and that this is a way that many of these huge conglomerates are working now, where actually, if you ask me, it seems as though it may be more efficient for the hospital system, but it is not as efficient for the patient, because the patient now has to travel further to get health care if they have a cardiac issue or if they're going to have a baby. I don't see, I know they're saying it that they need to do this because hospital systems are losing so much money. I don't know. When an MRI costs $3,000 at least, or $8,000. I was in the hospital for 16 days. I had developed in April. I have severe asthma. I caught metapneumovirus from one of my patients. I was in the hospital for 16 days. My hospital bill was over $150,000. Now, what would I do if I didn't have insurance? And even my insurance end of that is a big chunk. So there definitely are some improvements to be made in the healthcare system. But there's lots of opportunities out there for the disease prevention, premature death prevention for entire communities as well as the individual patient. So rather than choosing between one approach or another, the CDC has developed a conceptual population health and prevention framework. And they call these categories buckets of prevention. And that's what this article is all about. All right, let's look. Each bucket is needed to yield the most promising results for a population, regardless of whether the population is defined narrowly. So let's use an example. The patients in medical practice or broadly, as for example, the residents of a state. In a clinical setting, population health typically refers to healthcare delivered to populations of patient panels. In community settings, population health typically refers to comprehensive health in and outside the healthcare delivery system, provided to all individuals in graphically defined communities. So the three buckets characterize prevention in different settings. Bucket 1 includes traditional clinic preventative services, many which are now covered, benefits without cost, sharing for most health plans under the Affordable Care Act, and they're typically delivered in clinical settings to individuals who are healthy as primary or secondary prevention. Let's look at some examples. Immunizations, colorectal cancer screening, those are just a couple. And think mammograms, all of those things have to be covered by medical insurance. And before the Affordable Care Act, the insurance company didn't have to provide those services. So let's look at bucket 2. Bucket 2 includes innovative services that extend care from the clinic to the community, also delivered to individuals, but in community settings. So an example here is the use of a community healthcare worker to assess asthma triggers in the home. It's a way to augment asthma control in the clinical setting. So that's a really good way of considering that. I can remember back in the day when I worked in the hospital, we had a lot of patients developing severe headaches, and we had them come in and do an air testing, and it came out to be fine, but those are things that would fall in bucket 2. Let's look at bucket 3. This is community-wide interventions delivered not to individuals, but to entire populations. They benefit the whole community. So here is an example of a school-based program to increase physical activity among children associated with positive long-term health effects. It could also be something as simple as removing all high-sugar soft drinks from schools or candy bars from schools, because we have a huge pediatric obesity problem in this country. Now, health can be improved through attention to all three of these buckets. And so buckets 1 and 2 can be valuable to healthcare purchasers, payers, and providers by highlighting preventative interventions. So it's going to improve health and reduce costs. So it's, as I discussed in that previous video, if you can promote health and you reduce the incidence of disease, cost is naturally going to go down. But we have to have a process in place that will enable us to reduce those or to implement the programs we know will be successful. I love process improvement. When I did my doctorate, I did my dissertation and my project on antibiotic resistance. And so I implemented an antibiotic stewardship program in 54 clinics. And I didn't have a very long window. When you're doing these doctorates, you don't have as long a window of obtaining data. But the data that I observed showed that there was a slight increase in compliance of the providers' judicious use of antibiotics after the implementation of that. So those are things that can affect the whole community. All right. So here is the 6 high burden health conditions, and the CDC developed these to promote the adoption of, by healthcare purchasers, payers, and providers of evidence-based interventions to help improve health and control costs in the short term. So short term is less than 5 years, and we call it 618. It comes from the initial focus of 6 high burden, high cost health conditions and 18 evidence-based interventions that can improve health and control cost. So these conditions were selected because they meet the following criteria. They affect large numbers of people. They're associated with high healthcare costs. They're scalable. They're evidence-based, and interventions are available to prevent and control these conditions in the short term. Now remember, we're considering the short term, 5 years. The evidence-based interventions can be implemented by the healthcare sector, healthcare purchasers, health plans, and providers. Now let's look at these. Reduce tobacco use. I know where I work, not where I work now, where I used to work, if you smoked, you had a $50 surcharge on your insurance because they knew that you were at risk of increased health problems, right? So that's one of the ways to try to get people to stop smoking. Control blood pressure. It's a great thing that they have these blood pressure meters available in some clinics and stores. It's unfortunate I used to see them all over the place, but I don't see them as readily available anymore. But I know they have them at Jewel and Walmart. Also, there are some easily accessible manual or blood pressure cuffs that you can get at the store for people to use that don't need to be trained to use them. Prevent healthcare associated infections. So using good hand hygiene. And I have to tell you, when I was in the hospital, I was really impressed by the use of hand hygiene. Everybody, even the physicians, washed their hands or used hand sanitizer every time they came in the room. And they always cleaned their stethoscope before they listened to my lungs. Very impressed by that. Control asthma. They've come up with some great new medications to help control that asthma. Not only is it environmental, but the use of inhaled corticosteroids has been a huge change or improvement in asthma. Prevent unintended pregnancy. And I don't know, I really believe that today that there really should not be any unintended pregnancies. We've got Plan B, right? You can get it at the store. You don't need a prescription. You could just go in. But one of the things that is a problem is it's expensive. I don't know how much it costs now, but the last time I looked, which was probably a couple of years ago, it was $50. That's a lot of money. Not everybody has $50. But an IUD, you can go to Planned Parenthood to get condoms, an IUD, all of those things, and it's free of charge. IUDs are wonderful. But again, you have to explain to your patients that as what good as IUDs are, it doesn't protect you from HIV and HPV and hepatitis B and all of those things too. I could go on and on and on. In fact, I'll tell you a little story. I had a patient not too long ago. She came in and she was having irregular periods. And I go, oh my gosh, I did a pregnancy test. It was normal. I did a pelvic exam. Everything looked fine. I was, and I talk to my patients. I have a conversation with them. I'm not doing, sometimes it's people just go in and it's like, ask questions, and they're out. I talk to them. And I found out that she was using Plan B at least every month for the last year. Well, there you go. That's your problem. Why are you using Plan B? Why are you not on a birth control? There are so many that are easy to use right now. So we had that conversation. I gave her the information to go to Planned Parenthood because she was not insured. All right. Control and prevent diabetes. Wonderful drugs out on the market now. The injectables that work amazingly. Januvia. What are the other ones? And they also help you lose a little bit of weight too. The continuous glucose monitoring. Excellent. Patients can control their sugar. They're going to control their diabetes and have long-term decreased risk of coronary arteries implications, neuropathies, all sorts of things. So the 6 items that they chose very, very, very good because there are interventions available for us to see an improvement. All right. So 18 evidence-based interventions, and you can see this is pretty much what we were talking about with the reduced tobacco use. I'm not going to bore you by going through each one of these, but it shows you the differences. It's just what I was talking about. All right. So bucket 3, community-wide prevention. So how do we improve population health in our states and communities? What's the best evidence of health and cost impact? And what can we do that will begin to show results soon? So that's something that we're going to focus on. Community-wide prevention. Bucket 3. That's going to be something that I am really going to drill down on with you guys during the next 7 weeks. So please don't hesitate. Let me know if you have questions or comments regarding this video.